My dreams are still growing. Right now, at this point in my life, I would like to practice in the inner city, working with minority women, working with low-income populations and families. That would be my dream to do.
I enjoyed a 20-year career as a chef and restaurateur in the San Francisco Bay Area. There was something still nagging, and I felt that I could really make more of a difference and be more effective in changing lives as a nurse.
I am a pediatric nurse practitioner. I work in a pediatric primary care practice out in Brooklyn. We do everything ranging from newborn well visits to pre-college physicals.
So Columbia Nursing gives me the support that I need to continue with my goals in terms of becoming a midwife. I am a Columbia nurse.
About a week after I graduated college, I had a stroke. The nurses were really the ones that were involved most in my care from an emotional and physical standpoint. I'm in an adult gerontology nurse practitioner program, and I've started taking classes now to do the seamless DNP, where you just transition into the doctorate. So now I'm in the last semester of the master's program.
As a nurse, you get to follow someone through their life cycle. You get to follow someone through their hospitalization and see the transformation that happens to them.
I'm an immigrant. I was born in Guyana, South America. I joined the military, United States Army, and became an infantryman. I feel that services like nurses, teachers, doctors, soldiers, they kind of give to the country, they give to their communities, and I wanted to.
I recently obtained my MBA from Northeastern University, as well as a Master of Science in Finance, and so I want to use those degrees in addition to my nursing degree here to move into healthcare administration, ideally. I'm proud to be a Columbia nurse.
I've been a nurse for over 50 years. I graduated from Columbia in 1964 with one of the largest graduating classes. And since then, I've gotten my master's and my doctorate. I've taught at Columbia, I've taught at NYU, and I've also been teaching internationally in Mexico and also in South Africa.
You will always have a network of Columbia nurses to count on and to call up when you need them. And that's what I really appreciate about my education here. You do form lifelong friendships. More than that, you find a community and colleagues that you really respect.
People can really take my caring for their kids as not just she's doing this because she's a healthcare provider, but because I really care about their children and what's going to happen to them in the future. I am a Columbia nurse.
Before I started the PhD program at Columbia, I graduated with my Bachelor's of Science in Nursing, actually from a traditional 4-year program at New York University. Now that I have my PhD, I'm very excited to report that I have a joint research position both here at Columbia Nursing and also at New York Presbyterian Hospital. I am proud to be a Columbia nurse.
I feel very excited as a nurse informaticist because I feel like I'm in the center of the future of nursing. I'm in the center of what's happening, in society, intersection of all kinds of interesting trends with how people manage their health, how people access technology. I am a Columbia nurse.
I've always liked helping people. Whether I'm working in, shanty towns in Cape Town, South Africa, or I've been doing a lot of work in Haiti. It's the public health experience that I had at Columbia. If I had it to do all over again, I'd still be a Columbia nurse.
I think that the choice to come to Columbia is one that you shouldn't take lightly. I think that it will transform the way you think. You will be exposed to everyone and everything and every patient population. And I'm so grateful for that. What you'll carry with you is a sense that you have the skills you need. You have enough resources around you to help carry you through any new experience. I am a Columbia nurse.